evening and welcome to our show tonight. My name is Jim McGuire, your host, and tonight we have a very important show. We're going to be talking about preemie babies and their moms. And we have three mothers with us tonight now who had three preemie babies, and they're going to be telling us about the great struggle they went through to have these children. But I think at the same time, it's a great triumph to bring life into the world. It's a wonderful thing, I think. And also we have with us tonight a wonderful doctor from Maria Fareri Children's Hospital, Dr. Edmund Lagama's here, doctor. And he's going to tell us all about his special baby unit that takes care of these children, and also the medical staff that helps to bring these children into the world and help them. So if we just get started now, I just want to say that we have with us tonight Jennifer Degl. Jennifer is going to tell us about her family and what happened to her. And I wonder if you could just tell us a little bit about yourself, Jennifer.
Sure. My name is Jennifer Degl. I delivered my daughter, Joy, a little bit over 23 weeks gestation in May of 2012. We had a very, very difficult pregnancy with her, and she was born at Westchester Medical Center in Valhalla, and she spent 4 months in the NICU at Maria Fareri Children's Hospital, and Dr. Lagama was one of her doctors. Just in general, having a premature baby is very difficult. I want to impress upon that. November is Prematurity Awareness Month, and November 17th is World Prematurity Day. And it's really important to me, and I'm sure to the other mothers here today, that we kind of spread awareness about what it's like to have a premature baby in the hospital and afterwards. So people can either, look up information they can donate to organizations that help the families, or just be able to speak to somebody who had a premature baby with some understanding. And I wrote a book about my pregnancy and my daughter's time in the NICU. It's called From Hope to Joy, and there's a cover of it here. And Dr. Lagama is in it frequently. And it's about the struggle of having a premature baby and all that goes into having a baby in the hospital for a long period of time.
Very nice. Yeah, I read this book. It's called Hope to Joy. It's a fascinating book. It's published by Lemon Tree Books, and it really describes the great struggle of Jennifer having the baby. And I think she described in the book that she almost died 4 times.
Yes.
Is that right?
Yeah.
And when the baby was born, it was in intensive care for 4 months, I think. And did it weigh 1.5 pounds or something?
1 pound, 4 ounces.
1 pound and 4 ounces. So it was tremendous struggle. Thank you, Jennifer. Next person we have tonight is Debra Randazzo. Hi, Debra.
Hi.
Debra has 2 preemie babies. And how old are they now, Debra?
My son Matthew is now 13, and my son Dylan is 7.
Very nice. And I believe that you're the treasurer of the Hailey's Foundation for Hope. Could you tell us what that's about?
Well, my family's experience with premature birth is extensive. My twin sister Donna and I have had 6 premature babies between us, between 2001 and 2007. And it all began with the birth of my first son, Matthew, who was born at 28 weeks. And he weighed 2.5 pounds and was 14 inches long. And I had to deliver him immediately because at 28 weeks, I developed a life-threatening condition called HELLP syndrome. And I had to deliver to save my life as well as his. Then 2 years later, my sister delivered Hailey, who was born at 21 weeks gestation. And unfortunately, she passed away shortly after birth and is our angel in heaven. And then over the course of 4 following years, we had 4 other premature babies at 30 weeks gestation and above, and spent countless months in the neonatal intensive care unit. And through those experiences, we saw firsthand that while the babies were receiving the most advanced medical care possible, families often went unsupported, and they had very few avenues to turn to for help. So we took what we've learned through our NICU experiences and our premature birth and the tragic death of Hailey, and we decided to act and create a support system and a resource for families going through this. And we help families financially to help ease the burden, because having a premature baby and being hospitalized in the NICU is very overwhelming and frightening, but it's very expensive as well. and it turns your world upside down. So we help families also emotionally. We visit families at the hospital with their babies. We talk to them and comfort them as a shoulder to lean on or a hand to hold, coming from someone who's been in their shoes before and who knows what they're going through. We also empower families by providing educational resources and information so they can make informed decisions. They can be their baby's best advocate, and in return help their babies get better faster. And we also work very closely with the NICU staff, the doctors like Dr. Lagama, the nurses and the social workers to help enhance their family-centered care philosophy, as well as help them improve the quality of care that they give to their premature babies and families. And that was why Hailey's Hope Foundation was created. We saw a void and wanted to help. My husband, Jeff, founded Hailey's Hope Foundation in 2007, and we've been in existence for 6.5 years, and I'm happy to say that we've raised over $1 million for families and helped over 3,500 families, including the Degls and the Burtons.
Oh, very good. Thank you very much. Thank you. Our next guest is Julie Burton.
Yes.
Julie, did you have two twin preemie boys?
I did.
And did one survive?
One did.
Could you
yes.
tell us a little bit about that?
Sure. In January 2013, I gave birth to twin boys, Deskin and Jake. They were 24 weeks gestation. I gave birth to them at Westchester Medical Center. When they were 2 days old, Jake unfortunately did pass away due to complications from prematurity. Deskin did survive. He spent a total of about 6 months in the NICU. He was then transferred to Blythedale Children's Hospital, a children's rehab center, to continue his course of treatment. He had had a tracheostomy placed in his throat and a G-tube. He spent a total of about 9.5 months in the hospital before coming home last November. When he came home, he was still on the ventilator 24 hours a day, which continued until just this past September on Labor Day. He started doing some time off the ventilator. So he's come home with a lot of medical interventions. He's on oxygen, he has the ventilator, he still has the G-tube, a lot of stuff going on. But our experience in the NICU at Maria Fareri was wonderful and daunting all at the same time. The medical staff is wonderful, but as a parent, it's extremely overwhelming. But we're so grateful to the staff for all that they did for us and for our son to help him survive. And even for Jake, they did all they could for him and had a great deal of compassion for our family.
Oh, thank you very much, Julie. Dr. Lagama, could you tell us about your hospital wing that does all this work with these moms and babies? Tell us a little bit about it.
Well, it's known as a newborn intensive care unit or a neonatal intensive care unit. Most people hear it as NICU or NICU. And it basically is an area of medicine. It's intensive care specialized in the management of problems in the immediate newborn period. So unlike a pediatric intensive care unit where you have older children, typically a month or older, we would deal with babies up to about 28 days of age and all the way down to any period of viability, 22, 23 weeks in this era. And largely what we deal with is either respiratory problems is probably the most common thing, but often in a regional center like ours, there'd be congenital anomalies or enzyme defects, chromosome anomalies, or any other problem that the child may have some difficulty in making that transition from in utero to ex utero.
I see, Doctor. I just wondered about could you tell us, define what is a preemie baby, Doctor? What actually is that? Is there a certain span of time?
Well, the more recent recognition is that term pregnancy is 40 weeks, meaning 40 weeks since the last menstrual period. So a baby born below 39 weeks in today's jargon would be considered to be late preterm or early term, depends how you want to use the language. The point being that a full-term pregnancy is when all the organs, all the body functions have matured to the point of independent survival outside of the mother. Now, independent, of course, still requires nurturing and breastfeeding, handling for basic biological needs, warmth and comfort. But when a baby's born premature, it's below the 39-week mark, and more commonly, when the baby gets into an intensive care unit, they're typically in the 36-week and lower gestational ages. And that's because what they need is an assistance with making that transition from the womb to the outside world.
I see, Doctor, I see. I was going to ask you, Jen, about yourself now. When you were pregnant, did you worry a bit about your own health when this was going on? Because you had 3 boys at home, right?
I did.
Can you tell us about that?
Well, I was diagnosed with 100% placenta previa at 17 weeks. So from then on, I was in and out of the hospital. I was at Putnam Hospital a couple of times, and then I was transferred to Westchester Medical Center because they were best able to handle the issues with my pregnancy. And then my daughter, who we were told would definitely be born premature. It was just a degree. We didn't know how premature she would be. So yes, it was very scary. Some people are presented at the last minute, you know, with a premature birth. We knew we were going to have one. I don't know if that makes it any better. I don't think it does. I think it's traumatic either way. But we did have some time to prepare ourselves. I was able to do some research, what I could, you know, what a premature baby was. And then I learned what a micro preemie was, which is what Joy was, which I believe they say is 26 weeks and below. But yeah, it was a dangerous pregnancy, and I needed some medical care myself, besides, you know, before I had her, and then afterwards for a week or so in the hospital. So it was dangerous, but I'm fine today.
Very good. And how's the baby doing?
She's doing wonderful.
Good,
She
good.
was 2 in May, and she does have some respiratory issues, but other than that, she is doing wonderful.
Very good.
Thank you.
Doctor, what are some of the health problems that a preemie baby would have more so than the normal range who's born within, like, let's say 40 weeks? What would be
Well,
some?
the big issue with being born premature is being immature. So it's not just a small person, it's a small person who has every organ system requiring some kind of guidance or assistance to adapt to this world. So even things so simple as skin. A fetus is in the womb, it's surrounded by amniotic fluid, so the skin is very soft, very fragile. It's not a very good protective barrier. So simple things, straightforward, like just keeping water in the body and bacteria outside the body are major adjustments to be made. The one that's most focused on the first day or two has to do with breathing and respiratory problems that continue, because the lungs are different the earlier the baby is in 2 ways. One, they haven't actually formed the structure of the lung. And if you think of a tree with leaves upside down, all the branching of the air passages and the leaves being the air sacs called alveoli, like little tiny balloons, well, that branching cascade hasn't really fully formed. And the second big problem with immature lungs is that they're missing a chemical called surfactant. And what the word really means is surface active material that lowers the tension in the wall of the balloon. So if you think of an ordinary balloon and how it tends to collapse on its own versus a soap bubble, the surfactant acts more like a soap bubble. It tends to be very flimsy but stays open, allows gas exchange to occur. So immature lungs have 2 problems. The branching is immature, hasn't completed, and they're missing a chemical called surfactant, so the lung has a tendency to collapse. And a lot of energy is spent. In fact, most of our energy is spent on managing breathing.
Maybe you 3 ladies could talk about this. How important is the nursing staff and the medical staff? Maybe could you start with you? How important are they in helping?
Oh my goodness, they're so important. You know, my husband and I often say, you know, the nurses and the doctors, they saved our son Deskin, but they also saved us in a lot of ways, because they took care of us as parents and showed us how to take care of our son, but they also checked in with us on a daily basis. How are you doing? Are you eating? Are you sleeping? Are you taking care of yourselves? Because when your child's so sick in the hospital, it's very easy to forget to take care of yourself and to make sure that you're sleeping and eating and that you're healthy. And one of the worst things that can happen when your child's in the NICU is if you get sick, because very quickly you can't visit your child because they don't allow you in if you're ill, because it's so easy to get the babies sick. And just the support that the nurses offer and that the doctors offer emotionally to you, just to sit and talk with you and to discuss how your baby's doing. I mean, they're so invaluable in that way. They're very compassionate.
Do they get special training, doctor, those nurses, as opposed to the the normal nurse?
Yeah, in fact, the orientation program is almost 6 months for nurses working in the neonatal ICU because there are so many specialized issues, medically, technologically, medications, and certainly families. And it's a rather unique area in that the types of things we have to deal with really are not appearing anywhere else in any other portion of life. And I do think that one of the things we try to do, take time to be sure is how do the families respond? How are the parents interacting? Do they understand? So we actually encourage families to be on rounds, to participate right there at the bedside so they hear live action what actually is happening with their child, so they get a sense of the flubs and dubs, things that we misquote or misstate. Often moms will tell us, that's not the hematocrit. That's not what they said last night. And that's important because a lot of what we do has to do with establishing facts and acting on these things in a decisive way, and there's no room for mistake. You have to do it right. You have to do it the first time right. And so I think the combination of engaging families to be part of their own child's care, having the nurses make them feel warm and the medical staff make them feel part, especially if they're going to be there for 2 or 3 months. Because again, this is the tiniest of tiny babies or children with the most complicated surgical problems. They're often there for 3 and 4 weeks on average in the type of ICU we have. And as a result, the families should feel part and feel comfortable in being part of the day-to-day operation.
Right. Deborah, what do you think of the medical staff? You want to say something about the nurses?
With our experience, when you have a premature baby and they're whisked away into the NICU, it is a very frightening and overwhelming experience. And the nurses become your lifeline. Oftentimes, you're not prepared for what it's like to be in the NICU. It's a new world, and you have to learn a new language. And you may think that you're ready to hear the medical diagnoses from the doctors, but the nurses reiterate how important it is to do certain things, for you to be there, for you to take care of yourself, like Julie had said. And they're angels. They are true angels in our eyes, and they have such a unique job and a very difficult job, and we hold them in high regard.
Very good. And how about you, Jennifer? Could you tell us about your experience with nurses and medical?
Yes, amazing, especially at Maria Fareri Children's Hospital. My daughter was a little over 2 days old before I could see her because of my own issues. When I finally got to see her, I was a mess, just physically and emotionally, and it was very overwhelming. And the nurse I was on at her bedside that evening was the most compassionate. I couldn't have asked for a better first meeting with my daughter than to have that nurse that was there with me. She understood what I was feeling. She explained everything to me in a level I could understand at that emotional state. And that was my experience for the entire 4 months there, all of the nurses. And they become your family because you have to remember you're spending the majority of your day and night at the hospital. Right. And you're not seeing your own family or speaking to your friends. You just simply don't have time for that. So you're with the nurses all the time, and they become your family. They know what your other children are doing. They know what you had for breakfast. You know what their children are doing and what they did over the weekend. And you really become close. In fact, a couple of them have babysat for my daughter. Initially, when she came home, I wasn't comfortable leaving her with a regular babysitter. So some of the nurses, we remain close, and they will babysit for her on occasion. That's how close they become to you.
I think in your book you said you went sometimes at night to see your daughter, and it was very quiet.
I did.
Want to tell us about that?
Not everybody has the ability to do that. I was lucky to be able to go back at night. It was only 30 minutes from the hospital. And I'd be able to go at night when my other children were sleeping, and it was quieter, and it really was an amazing moment. And I was lucky to have a very nice reclining chair, which I know Hailey's Hope is working on getting for everybody. But it's those moments where you're really not being bothered, and there's there's less doctors coming in and out of the room in the evening, and it's really a nice bonding moment. And those are my favorite times, just spending night with her as long as I could.
Very good. I just was wondering, like maybe the doctor and the rest of you ladies could answer. What is the most important quality or asset needed to bring forth the child? And is it stubbornness? Is it spirituality? Is it would you want to say something, doctor? What is the asset they need to bring this forth?
That's a good question.
Well, I would say for a neonatologist, one of the most important attributes I would spot in someone who's a trainee or an excellent clinician is an extraordinary attention to detail, because everything has to be paid attention to. You can't, there's no margin of safety for that preterm baby. The tinier the baby, the less ability they are to tolerate changes in simple things like temperature, or changes in oxygen, or changes in the amount of nutrient you give. So it's really keeping them, I use the analogy, on the razor's edge. Don't let them tilt too much to either side. And if you can do that, if we can manage that, then the best outcomes are likely to happen. There's no guarantee in life, of course, like any healthcare issue, but the closer you are to not falling off the edge or not tilting too far to one side, the least likely you are to get into trouble. So a stubbornness, a perseverance, an attention to detail, and I think a willingness to go beyond, because many of the nursing staff and the medical staff, they realize the patient's not speaking to them, so they have this sense of ownership or dedication that they want to make sure nothing happened to that baby who's not able to speak and tell of their needs. And so there's a sense of constantly checking or being involved or being on top of the issues and not letting things get unraveled.
Okay. Jennifer, like for instance, with you, what was it with you? Was it like a stubbornness to keep going, not to give up? Because in your book, you really seem to be constantly pushing for the child to be born.
Well, yes, I am stubborn, for sure.
Is that what it is?
But, I think all of us as parents, whether your child was premature or full term or sick or healthy, you really, I think you need to be stubborn, and if you really feel that something is wrong or off, you need to speak up for yourself. As far as my pregnancy, we did our best. We weren't positive we were going to have a good outcome with Joy, but we did our best, and we listened to our doctors as best as we could, and we kept the pregnancy going as long as we could. And her stay there, I would really say that she was stubborn and determined, because she was the one who had to respond or not respond to her treatment, and she really did very well because of the doctors and nurses, but she responded very well.
How about you, Deborah? What was it for you? Was it like stubbornness or something else?
Yes, I'm very stubborn. But you get the strength to get through it. God gives you the strength, and you need faith. And like Jen had said, you need to be a proponent of yourself, for yourself. And knowledge is power, especially in dealing with a premature experience. The more that you know, it will help you in the long run.
Yeah. How about you, Julie? What did you sense the asset was for you?
I think a lot of what Jennifer and Deborah said, I think just believing that your child is going to fight, and watching them and just being inspired by them, honestly. Watching Deskin fight every day, and even though he was so tiny, under 2 pounds, and watching him be so feisty and fighting off, as the doctors and nurses would be trying to prick his heel to get blood, and he would knock them with his arm, and hurt them. It was amazing to just watch him be so feisty at such a small little body. It was inspiring, and you just had to believe that, he was going to be okay, and have that faith in him. And in the medical staff. Yeah, just don't give up.
Can I make an additional point? It's important to recognize that the vast majority of pregnancies go without a hitch, that healthy women have healthy babies, and over 90% of the time, and the times that you do need some help, either with prematurity or congenital malformation, that's where the medical services come in. And babies born in this micro-preemie category we're just talking about, around 24 weeks, make up less than 1/10% of all births.
Wow.
So it's a very small quantity of people, and that's where the specialized needs are important, because you need the people, experience, the resources, the equipment, the sense of a 24/7, come in the middle of the night, it's a little quieter, but everything still has to be available all the time.
I see, yeah. I just want to ask you ladies, what advice would you give mothers who are in that same predicament now? Any advice you would like to give them? How about you, Jen? What do you think?
Really my advice would be, like we were just talking about, to not give up, be persistent, and really involve yourself in the care of your child. It's not just for prematurity, it's for anything. I really think the more educated you are, the more almost I guess, relaxed you'll feel, or the better you're prepared to handle what may come. And rely on the nurses and the doctors. And we had a great experience at Maria Fareri Children's Hospital. One of the very first doctors I spoke to was Dr. Lagama, and Joy had a little, like a red dot on her skin, and it was called hemangioma. And I just mentioned it to him in rounds, probably the third time I even maybe talked to you. It was early on. And he came back to me like within a couple of hours with this big packet. He printed out, he took the time to, and I really appreciate that, took the time to give me an information so I wasn't looking up incorrect information on the internet. I think the more involved you can be, I think the better off, and never, ever, ever give up. I think you don't know what can transpire, things can happen.
Thank you. How about you, Debra? What do you think? you said?
I agree with Jen. One of the most important things that families can do is participate actively in their baby's care. And research has shown that when families are active participants, that babies reach their milestones faster. So that would be a recommendation that I would say for families who go through this experience as well. Educate yourself, stay healthy, try to stay healthy, because as moms, we know we try to take care of everybody else but ourselves, but like when Julie had said, when you get sick, you can't see your baby, and that's actually what happened to me when I had Matthew. I was at his bedside morning, noon, and night, and I didn't want to miss a beat. I didn't want to miss anything, and I was there for rounds and stayed for maybe 10 hours, 12 hours, and I didn't take care of myself, and I wound up getting sick. And I wasn't able to see Matthew for 4 days, and that was one of the worst things on top of him being born prematurely. So taking care of yourself, very important, and being an active participant in your child's care.
Very good. Julie, you want to say one thing? We're finishing up. You
Sure.
want to say something
I
quick?
would say, you know, even when you're not able to hold your baby, sit next to them and sing to them and talk to them. Hold their hand if you can, because even the littlest things, you know, they're still babies, even when they're surrounded by all this medical equipment, and they still need to hear your voice and feel your touch, and it makes a huge difference to them.
Even singing, huh? Singing?
Yeah, even singing.
Well, exactly, because part of development is actually the interaction of sound and touch
Right.
and involvement. So these things are really not just nice, they're actually effective in assisting in brain development for hearing, brain development for visual stimulation, use of hand coordination, and that goes out through the rest of their first year in particular.
Well, listen, we have that finished, so thank you very much for coming, Doctor, and all you three ladies. Thank you very much.
Thank you.
Very much. It was great. Thanks a lot for watching.